talking about cholesterol and connecting it back to heart disease in the African-American community, just across the board. So if you join in, I hope you learn something, and then I hope that you take that information back and share it with your families. That's how each one teach one. Right, Doc?
That's absolutely right.
And so that's what's happening tonight. So we're going to talk about cholesterol. We're going to just dive in. I feel like you guys should know us. I'm Tara Robinson. I am the founder of Black Heart Association. I'm a 3-time heart attack survivor. And we're just out in the community, just educating and learning and taking care of each other's hearts. And that's what it's about. So I'll let the doc introduce himself.
Hello, everyone. Please forgive me for looking at my multiple screens. Try to get this together for you. I am Carl Middleton. I am an internal medicine physician at PPA Health and Wellness in Fort Worth, Texas, along with my partner, Dr. Naja Thomas. I am an internist or an internal medicine doctor. I am also assistant professor of medicine at TCU and UNT Health Sciences Center.
I didn't even know that. See, you learn something new every time. Look at you, Doc, out here educating the folks. I like that. Good to know. So, guys, this is Heart Month. This is such an important month for Black Heart, but every month is an important month for Black Heart because we're always educating the people. So we're going to talk about cholesterol. And I have to be honest, I was telling Dr. Middleton, there is a lot of things that I don't understand about cholesterol. And he was telling me how in detail that subject is. So we'll try to make it as simple as possible for everybody to understand. Well, I won't, but the doc will try to make it as simple as possible. So I'll just start the conversation, Doc, by asking you, what is cholesterol?
As you were just saying, it can be a very complicated subject matter. We think of cholesterol as something that's floating around in our blood system that clogs up our arteries, but it's much more than that. So cholesterol is a molecule, and there are many different types, but at its base, it has a fat. A fat is not permeable to water, so it does not let water through unless it binds with something and a combination of things happen. But there is a fat and there are other proteins. Our bodies make 75% of the cholesterol that we have as humans. The other 25% come from the things that we consume or eat. And not just anything we eat, but specifically animal products, meat, dairy, cheese, eggs. Certain seeds, nuts, and things have some good cholesterol, but mostly they're coming from animal products. And so 75% your liver makes, and so you're born with that ability. And that goes without saying, if you have a liver issue, then you're going to not be able to make cholesterols, or you're going to make too many cholesterols. And so the molecule that is made goes into almost every cellular function that we do. Cholesterols make up the backbone of most of the products that your body is attempting to make, everything from vitamins to hormones. Okay. Now, it is not until those things start to accumulate in your arteries that you start to have a buildup of bad cholesterols. So that's the general idea of a cholesterol. It's a molecule that is involved in just about every thing that your body is attempting to make, because it usually makes up the backbone or the structure of it. And in the core, you either have triglycerides, LDL, which is bad cholesterol, or HDL, which is referred to as good cholesterol. Now, there are a number of other cholesterols, but those are your basic cholesterols, okay?
Okay. So only 25%, and that 25%, it sounds like it plays a major part, because we're always talking about diet and, you know, what should we be vegan, vegetarian, all of this stuff, and it's all that little 25% and how much damage you can do.
Well, let me make sure I'm clear about this. Your body makes 75% of your total cholesterols, right? Now, if you are obese, then you are going to make excess cholesterols in general, or excess bad cholesterol, i.e., LDL cholesterol. And yes, 25% come from our diet. However, if you have hypercholesterolemia or hypertriglyceridemia or elevated triglycerides or cholesterol, the very first thing you want to do is to attempt to lose weight in most cases, because that will tell your liver to stop making so many cholesterols. So that's the first thing, what your liver does. And then you want to modify your diet, taking in fewer animal and animal products in general to lower the other cholesterols. Um, Same cholesterols, but to help lower cholesterols. And if I may, without being too nerdy here, um, you hear about trans fats and unsaturated fats and so forth. Um, Cholesterol comes in that shape. If you open up a can of Crisco, which none of us should be doing anymore for the most part, that oil that has been made into a solid product in order to put into the can, or in order to
Mm.
keep things stable, that is then even more loaded with cholesterols, because that is a trans fat, meaning they've solidified it in order to make it that way. And I don't mean to pick on cholesterol, but any or Crisco, but any product that is made solidified. And it's not just the things that come in a can that we fry with, but there are other products, once they're packaged, that trans fats are placed on them. And the whole idea of fats and cholesterol is our body has very little ability to break them down or to get rid of them. And that's why they ultimately will accumulate in between the layers of your blood vessels and inside of your blood vessels. And that's what leads to what we were talking about earlier, plaques, or things that, they build along the side of the walls of the vessel. If this is a blood vessel like a tube, then plaque is starting to build along that wall. And all of a sudden, you go from having this much space to allow blood through to this much space. And if it closes down, then you could cause a heart attack by blocking a blood vessel. A heart attack or a stroke, or disease in your hands and legs or kidneys, anything that artery, whatever that artery's function is, or whatever organ that artery feeds, if it gets blocked up, then we've got some major issues.
Wow, I'm over here cringing because I can just think of the history of Crisco and how it plays such an important role in the Black family for years. My grandmother, and just how how this has impacted our bodies over time is just such a scary thought to me.
Mhm.
So thank you for that information. So when we talk about cholesterol and we break down those, because when I go to in the past, before I start seeing Dr. Middleton, I rock with Dr. Middleton, y'all make sure y'all go see him and book, as make him your primary doctor here in the Dallas-Fort Worth area. But before I would just get the total cholesterol. When I go and get my annual, here's your total cholesterol number, and still not even really understanding what total cholesterol number even meant until after I had my heart attack. Can you explain to us what we should be getting from our doctors at physical time as far as cholesterol is concerned?
Yes. So one of the things you want to make sure you do, which you alluded to, if your physician does not offer, is to ask for your labs while you're there or after. I generally try to give the labs to the patient while they're in front of me, and sometimes I will email it to you or fax it to you if you give me that permission. Um, so that's the first thing, is to ask for it so you can start to see it and keep track of it on your own. But you generally expect to see four things. Okay. You have total cholesterol. And anything that says total, that means it's a combination of things, right? So that would be the combination of LDL and HDL, which I'm going to get to in just a second. Okay. LDL is the bad guy, low density lipoprotein. That's what LDL stands for. That's the one that's most associated usually with heart disease, stroke, peripheral vascular disease. That's the bad one, LDL. HDL is the good one. So everything good comes from up high, right? That's how I like to believe it. So HDL, the H stands for high or high density lipoprotein. That's the good guy. So LDL, HDL, and those two things together make total cholesterol. And then there is triglycerides, because triglycerides are slightly different than those two. Now, the next thing you're going to ask me is, what are the numbers? Where should they be? So there, depending on who you ask, there are several ways to look at this, right? In general, you want your total cholesterol to be under 200. Okay. And there's a whole, that's 200 milligrams per deciliter. The unit doesn't really matter. It should be the same unit if you're talking about cholesterol here or in the UK or in South Africa or in Qatar. Doesn't matter where you are, the unit should be the same. But 200, less than 200 is where you want your total cholesterol to be. The probably the most important player is the LDL, or the bad cholesterol. You want your bad cholesterol to be less than 100. And then the good guy, the HDL, you want that to be high. The higher the HDL, the more you're getting protection. So if your HDL is less than 40, that's bad. If your HDL is greater than 50, that's good. If your HDL is greater than 60, that's really good. Now, it's not so much about just looking at total or just looking at LDL. There are a combination of things that your provider should be talking to you about. You can have, for example, a total cholesterol that is not over 200, but your triglycerides and your LDL may be high. Okay. I'm sorry, your triglycerides and your LDL, I apologize, can be high, and that may need to be treated, or certainly some education should happen. Your total can be just barely over, but your triglycerides can be off the charts,
Right.
and that may need to be treated. That's usually a genetic issue. And I'll come back and clear that up in just a second. So it's a combination of factors. And there's also one other factor when you look down there. There's a calculated non-HDL cholesterol. So there's also, sometimes people have some numbers that are a little bit unusual because of their diet. And so there's a calculated one that we look at. So I would say to you, in general, you want to make sure your total cholesterol is less than 200. Your LDL is less than 100. Your triglycerides should be in the same neighborhood. And you want your HDL, if we can get it there, to be greater than 50 or 60. So not necessarily one number, but a combination of numbers. There are about 3 or 4 of them you really want to remember.
So I hope everybody heard that. We want to, we might get a total number, but then you need to get the breakdown of those numbers. And then if you don't understand what those numbers mean, you then need to ask what those numbers mean.
You need to ask, and this is the one time where I might say, I give each patient license to go to the internet. We don't like taking a whole bunch of things from the internet because we never know what the source is, but you can generally find normal total cholesterol, LDL, HDL, triglycerides on just about any reasonable website. And if any of your numbers look off, then ask that question. If any of those 4 numbers are elevated or low, then ask the question.
That's the question. And we hear a lot, sometimes we hear borderline, you're borderline with your numbers.
Mhm.
Is that when we should be concerned? Or when is the flag? I guess when those numbers go up above what you just said, that's when we're raising the flag.
Very good question. And a lot of times when we're talking about cholesterol, we also want to take into consideration the whole patient, right? Because if all of your numbers are right at the border and you're 35, then that's probably you generally have a lot more life to live, and that's going to mean something if you don't get after it soon, right? Um, we tend, or we've been taught not to use borderline as much as we did in the past, because for whatever reason, we tend to take the good side of that and not the bad. We tend to say, well, my doc said I was borderline, so I don't have high cholesterol. That's what we hear. And so a couple of years ago, most medical organizations agreed on those numbers. Now, I will say, before we talk about how do you treat it and what to expect, not everybody who has a little bit of high cholesterol, it doesn't absolutely need to be treated with medicine per se. Now, I'm not giving people license to stand in front of their doctor and say, Dr. Middleton said I don't need to take that medicine. That's not what I'm saying. What I am saying is lifestyle changes, weight loss, dietary changes certainly need to be made if your numbers are elevated, or if your numbers are elevating. We need to get active and increase our exercise, certainly. But for example, let me use myself, for example. I'll use myself. 40 hit a couple of years back, and no longer as in shape as I used to be. And I spend most of my free time just watching kids play soccer and go to school and so forth. And so my partner, who is also my physician, checked my labs, and she comes into the room and she's writing a prescription. And I'm like, what are we doing? And she's like, you need some cholesterol medicine. And she tells me that my total cholesterol is, I believe it was 262. Not good. Over 200.
Yes.
Right? So I said what most other patients say. Oh, doc, give me 3 months. Give me 3 months and I'll get it together. But I took that very seriously. Again, as I said, I was over 40. It's the first time in my life I ever had, blood pressure or cholesterol or anybody say something wasn't quote unquote normal. But I addressed some very specific issues that I know I have. One is I was starting to get overweight. So I went out and made it my point to lose, I think I lost about 15 pounds in the 3 months. I was very serious. But then I had some very other specific issues. My wife, if you know my wife, you know that she's a cook and she's a foodie. And at any given point, you can pull out my drawer in my refrigerator and see about 7 or 8 different types of cheese. Yeah. And I'm not talking about slices. I'm talking about wheels and blocks and all kind of stuff. And, we had gotten to a habit. We're just walking around the house at night and we're cutting off pieces of cheese and we're just sitting in front of the television. So long story short, I got my act together, and, with the help of some exercise, weight loss, diet change, and I did take some omega-3s, which we'll get to in just a second, I was able to move my total cholesterol down 66 points. Now, I'm not going to lie to you. Most people are not, that would not happen for most people, not that much of a change. But, I was really eating a bunch of cheese and eating a bunch of stuff I shouldn't have been. So it was a self-check. Um, but what I the
People, it's hard for people to cut out. It's hard for, I love cheese. That's one
Mhm,
of my vices.
mhm.
But it is so hard to cut out those things that we love so much. So we understand that it's not easy. Just start making those small steps, and hopefully they'll lead to bigger steps.
And what I try to tell patients all the time is I try never to ask you to completely cut anything out.
Mm,
Um, because I know by human nature it's not likely. But if we make those small changes on the front end, then you don't have to make those incredible changes on the back end. Now, I still eat cheese and I'm not a vegetarian, but I watch it and I don't spend 2 or 3 nights out of the week just cutting off pieces of cheese and olives and walking around thinking, "Oh, everything's fine." So yeah, small changes on the front end will go a very long way.
thank you for being honest with us, y'all. This is what is needed, a transparent talk, because if the doctor says he knows it's not easy, then don't expect it to be easy for you, the regular person either. But he is also saying that you can make the changes that you need. I can make the changes that I need. We all struggle. Exercise is my vice. I can eat well, but that exercising, yeah. So,
Oh yeah,
we all have our thing, but we can just, make an effort every day to do better if you
yeah,
want to. I
yeah.
guess that's all down to. Doc, let me ask you this. I can't wait to get off of here and go look at, I have my medical records, so I can't wait to go look at my medical records, because I do not ever recall seeing the triglyceride numbers there. I only see the LDL and the HDL, so I'm very curious to see over all those years was something missed, especially for a person like me that does not have high cholesterol or high blood pressure. I didn't present with those two before my heart attack. And I still don't think.
Yeah.
So, what do you tell is thinking about cholesterol and plaque,
Mm.
are they the same? I know that sounds, I'm the survivor, y'all. I'm not the doctor, so I'm just asking questions that come to my head. Is that the same?
Well, you're asking the questions that everybody tends to ask, and that most people, if you have the question, somebody else has the question too. Um, I think there were a couple of parts of your question, but I'm going to try to answer the whole cholesterol and plaque. Okay. So think of your arteries and blood vessels as water hoses of different sizes and lengths. Okay. If you have a water hose out near your garden in the summer, you turn the water on, you want the water to come out full steam. Every now and then, dirt and things start to accumulate on the insides of that hose. That is plaque. Okay. Now, cholesterol makes the bulk of that for sure. Remember, I said that we have a hard time ridding our bodies of cholesterol. And so cholesterol will be a good part of that substances that are starting to stick inside of your blood vessels. Now, when things start to stick as other blood is passing by, more and more blood molecules will stick and accumulate as well, right? Does that make sense?
Yes. Uh-huh.
The other thing that you will see is inflammation.
Mm,
Okay. So most chronic diseases, when we look into the organs or the vessels of someone who had a chronic disease, whether we're talking about cholesterol, blood pressure, diabetes, there is some amount of inflammation. And just like, let's say you have arthritis and your elbow gets inflamed and swollen every now and then. Uh, and then you have other cells that are coming to that area to try to deal with the inflammation. So you have cholesterol, you have inflammation, and then oftentimes it happens in between the layers of your blood vessels. So it'll start to build up, and you got a plaque in between the layers of the blood vessel. And over time, if your blood pressure is high, or if you have a terrible diet, then all of a sudden that plaque ruptures out, and now it's traveling in the bloodstream. And because they're not very water soluble, then they build up, and wherever they build up downstream, they're going to block something up. So cholesterol is a big part of plaque. Yes. The second part of your question had to do with triglycerides. Remember, I said that triglycerides are just slightly different than total cholesterol, HDL, LDL. But triglyceride is usually at the center of your cholesterol molecule or your triglyceride molecule. And triglyceride is less soluble than the others. So certainly, if your triglycerides are high, you can expect that they're going to start creating plaque and blockages in your blood vessels. Now, all of us, as we get to a certain age, and that age is generally about 40, you're going to see plaque and small amounts of plaque throughout your vascular system when we reach that age, especially if you are a meat eater. Um, it's going to come for everybody. It doesn't matter if you eat meat or not, it's going to come. If you eat meat, it's probably just going to come a little bit earlier. But triglyceride is less soluble than the others. And so um, triglycerides would be a part of that as well. The other thing about triglycerides are there are a few genetic conditions where your cholesterol can be okay and your LDL can be okay, but your triglycerides can literally be off the charts.
Mm.
And so, um, we get those people every now and then who you check their whole panel and you want to make sure you've done the whole panel and you want to make sure they were fasting when you check their blood and their cholesterol panel, and then you look down and everything looks okay, and then all of a sudden that triglyceride is in the hundreds or sometimes even thousands. When that happens, you need to go look for other medical conditions. Now, it can certainly still cause heart attack, heart disease, vascular disease, but there are other genetic conditions usually that would lead to extremely elevated triglycerides.
Wow. That's all I can say, guys. It's wow. It's so much that we have to learn as it relates to our bodies and what we need to know when we go to the doctor. The cholesterol is checked annually. Is that correct?
It should be after age 35. Some organizations say 40. Um, I would say if you're over 35 and you're having your yearly physical, don't be afraid to ask the doctor, will my cholesterol be checked? Uh, and that, and if there's a reason why not, they should tell you, but otherwise you should ask for it and expect it to be done. There are other times where we check people's cholesterol as well. But generally after age 35 with your annual physical, you definitely should have cholesterol checked. Now, if you have other comorbid disease, it may be checked earlier than that.
Like
Let's
my
talk about let's talk about the medicines. I'm sorry to cut you off. Let's talk about medicines real quick, because what I often hear is people's fear of taking certain medicines.
Yes, and there's a whole trust issue going on in our community, and I hear it on Clubhouse, on all the social platforms where people are talking. We don't want to go right to the meds, and they feel like doctors just push that into our lives. Explain to us why medicine is needed here.
Mhm. So I started to say earlier that just because your cholesterol is a little high, notice I say a little, you may not necessarily need medicine. And obviously, dietary changes and weight loss, if that's the case, certainly should always be practiced and talked about initially. Um, Sometimes people, I often hear, oh, the doc just wants to throw medicine at me. Oh, that's the only thing you guys ever want to do. Well, if we start to make those small changes that we talked about earlier, then we can hopefully avoid the medicines. But oftentimes when people come in, like I mentioned myself earlier, my cholesterol was 260 something. That is generally a point that needs to be treated because it's creating a risk factor for heart disease and heart attack and stroke. Um, but when we back up and we talk about, let's talk about the different classes. There are basically, let's see, there are statins. You hear that all the time. My doctor tried to put me on a statin. There are fibrates. There's gemfibrozil, that's a fibrate. There's niacin, there's omega-3, and then there are some medicines that are cholesterol absorption blockers. Let me turn my page here. It's just so I don't leave any out. Sometimes I talk from the heart and the head and I'm might leaving something out. But in general, if your cholesterol is high, most of the time your doctor should be talking to you about a statin medicine. I say statin because that's the class. They all end in the word statin. Atorvastatin, simvastatin, rosuvastatin, and so forth and so on. The reason why that is the standard is because it lowers total cholesterol and LDL more than any of the other classes of medicine. Lowers the total, lowers the bad, and slightly increases the good. Okay, so that's what most people should be talking about initially. If you're one of those people that I just talked about where your triglycerides are very high, but the others are not, then your doctor may want to start with one that sounds or ends with fibrate. That seems to work best for elevated triglycerides. But almost in almost all cases, statins should be started because they work much better. They work on all three lines, and they do the most in terms of dropping the cholesterol and the bad cholesterol and raising the good cholesterol. Now, statins, just like every other medicine, have some potential side effects, and two of them in particular that we always look out for. One is that statins can give you a very severe muscle cramping and pain. Now, I'm not talking about people hear that their cholesterol's high, they start trying to work out, you hadn't worked out in years and you're having some muscle cramping. I'm not talking about that. Usually people, if you have this reaction, which is a very small percentage of people, you will start having muscle cramping, often in unusual places, and it will just kind of escalate. But the good thing is you stop the medicine and you don't have to worry about it usually. When I say unusual places, I'm talking about buttocks, thighs, back. You can get it in other places, but we're talking about a very severe muscle cramping and pains. The other one is it can elevate your liver enzymes. Now, I'm not talking about your cholesterols, but your elevated liver enzymes, meaning it is broken down and activated by the liver. And so if it's not clearing very well, then it can make your liver enzymes go up. And so anytime you get started on a statin or any other cholesterol medicine, you probably should have some labs within a couple of months to check your liver, check the muscle enzymes, etc. So those are the two big ones. Now, there's a new thing over the past couple of years that has hit the news that people are talking about often. I don't want to take statin medicines because I hear it's going to make me a diabetic or cause me to be a diabetic. All the studies are starting to show that it is true. People on statin medicine can have their sugars elevated a little bit, okay? Especially if you're taking it for many, many years. Your sugars can go up a little bit. It will not make you a diabetic. And the people who generally have this issue are the people whose sugar was high to begin with. But yes, there is some truth to statins potentially elevating your sugar. But again, it's one of those things where you have to make a decision. Are we going to let people walk around with a total cholesterol of 300 and an LDL of 250 and every single day having risk factors for cardiovascular disease? Or are we going to hold on to that one little fact that we know that it may make your sugar go up a couple of points and let that be the reason why we're not taking it?
Let me say this, Doc. I was that person after my heart attacks. He was, for me, for a person that's never been on medicine, it is very hard to have a doctor throw a whole bunch of medicine at you and say, take this, take this, take. I think that made me depressed, actually. And so I said, well, give me a chance, give me a chance. But he definitely wanted me to take it just as a preventative to not have another heart attack. So I definitely understood that. So I did take it for a while. I think most people think too, you always hear in our communities, if I start this medicine, I won't be able to get off of it. So can you speak to that? I mean, I know we hear it a lot with blood pressure, but I just think people have it in their minds. If I start it, I have to take it for the rest of my life.
At least two very good questions couched in that example you just gave. Let me try to piece it. Let me try to take it apart for a second. Well, let me start with the back end. It is true that we probably in medicine have not done a good enough job of, when we get people on a medicine, that we're really working towards a goal where we can try to get them off of the medicine. And so oftentimes people were put on medicine, particularly, 10, 15, 20 years ago, or even further. And we didn't do a great job of educating them and trying to get them off of the medicine. And that should always be our goal. But like I tell patients all the time, I got my goals and my priorities right in front of me. Now I need you to help me get to where we need to get to, because I can't lose the 20 pounds for you. I can't change your diet. I can't make you more consistent and get those numbers where we need to be. And sometimes people think when they reach those goals, then they can just stop the medicine. Now, don't forget, it was the medicine that helped you get to the goals. It's often the medicine that is helping you get there. And so if we remove it, then you can expect those numbers to rise and keep presenting a risk factor for you. We're talking about heart attacks, strokes, peripheral vascular disease. And so oftentimes patients, they want to feel like, okay, I've made this improvement. Well, you have, and kudos, but it's also the medicine oftentimes that's helping to keep you there. Okay. Now, the other thing, especially in your case, or people like your case, when medicines come online, there are other things that we start to know about these medicines from studies that come, after. One is that statins are cardiac protective. They're cardiovascular protective. So not only will they lower your cholesterol, but they help to stabilize those plaques in your blood vessels so that plaques don't open up and rupture, and then putting you at imminent risk for other events. And so if you've had a heart attack before, for most people, especially at the age group where heart attacks generally happen, you should probably be on a statin for, I hate to say for the rest of your life. I hate to say that, but that's the truth for most people, because not only is it lowering your cholesterol, but it is helping to stabilize your blood vessels, which will help to prevent further events. And so the same thing is if you're a diabetic. If you're a diabetic, we know, and it is without question, that you should be on a statin medicine along with some other things, because they will help prevent heart attack and stroke. And that is independent of lowering your cholesterol. And so now, a lot of the onus should come back to the clinicians, because if we explain this to patients, and if our expectations are at the same level, then then patients don't have to resort to unfounded information and all the stuff they see on the internet and what cousin Larry said about his statin. You know,
I'm over here. I'm guilty. I'm guilty because I'm stubborn. I'm one of those people that was like, I don't want to take this statin, and I still today have not. But talking to you tonight has helped me understand why my doctor was insisting that I do it. And I'm like, no. And my husband's like, do it. And he always has to remind me that you died. And so you definitely need to be on a statin. And so I'm going to call him up and get on that statin because I don't want another heart. I don't want to be back in the same situation.
We can take care of that.
Okay.
So, we can take care of that. Now,
I don't want to have a heart attack, and I don't want to risk my life just because I was uneducated.
So let's talk about something else too, because people, if we say, oh, we put you on a statin, people want to know, is there something we can take before we get to a statin? Or what everybody wants to know nowadays, is there something more natural? In this case, there are a couple of things that can help. Now, let's be clear. They are not, and if you need a medicine or if your numbers are at a certain level, those natural things, I don't have any problem with natural because most medicines come from the concept of what we know about plants and other herbs and so forth. But we've gotten to this kick of natural, and I'm going to do this thing natural, and the evidence just isn't there to support what many people are attempting to do. But in this case, a very good omega-3 vitamin is certainly protective and will help lower your cholesterol. Again, not as much as a statin, and it should not be done for the person whose total cholesterol is 300. It shouldn't be done by itself without the statin, I would say. But omega-3, which is harvested from fish, because fish is not just any fish, but white flaky fish, usually from very cold climates, is where we get very good source of omega-3. If you can get omega-3 online, you can get it in GNC, you can get it anywhere from $11 to probably $60 a bottle. There are two components of omega-3, the two active ingredients that will help lower your cholesterol. And in general, you want to take 2 of those tablets at the same time. And if your cholesterol is really high, you probably want to take omega-3 with a statin or one of the other medicines. And you want your diet to mimic that. We want big flaky fish. We want to avoid fried foods. We want to limit and cut down our animals and animal products. I want to be clear, I'm not a vegetarian or a vegan or any of those things, but as adult humans, we don't process other animals as well as we did when we were younger. And those things start to stick into your arteries. So omega-3, eating a diet that's good in HDL and good cholesterols, certain seeds, nuts, fish, things we call legumes, beans. They're often good sources of omega-3 and good cholesterol. Now we have to stop adding a whole bunch of the stuff to it that makes it less.
That's some dishes.
We can fix up some dishes, and I know all about it. I grew up in the same neighborhood you did. So, but there are ways to do it that it doesn't have to be, we don't have to add the stuff to it that is taking away all the healthy properties.
Agree. We have kept you, Doc, for a while tonight. This has been a great conversation. What I hear you saying is prevention is better than treatment. To go see your doctor annually, to have those total cholesterol numbers broken down, and if you don't understand, ask for a cholesterol panel. Is that the right verbiage?
Yeah, cholesterol panel. You want to make sure you're fasting, and ask your questions the same way you would ask your mechanic, the same way you would ask your barber, your beautician. If you don't understand what you're getting, ask the questions.
Ask the questions. And if you're not comfortable asking your doctor questions, then you might need to change, because that plays a key part. You have to be comfortable with your doctor. You're the customer, and he is there to service you and give you 5-star treatment. That's how I
That's
see
right.
it.
That's right.
And so if you're not comfortable, consider changing doctors, because your life matters to not just you, but somebody else. Know the signs and symptoms of a heart attack and stroke. For women, we can be asymptomatic.
You can be asymptomatic, but generally for women, they have atypical, unusual pain. So where men will often have a chest pain, women can have just nausea and vomiting, or an arm pain. So unusual symptoms for women. If something's persistent, doesn't feel right, go and get it checked out.
Don't get it checked out. You know your body better than anybody. You know your body. So if something's off, go get it checked out. You matter. And that is all for tonight, Doc. Any final thoughts? Anything you want to say before we?
Per usual, Mrs. Robinson, Black Heart Association, we thank you. We thank you every time you have us on. We're happy to help at any time, and let's take care of ourselves.
Let's take care of ourselves. If you need Dr. Middleton, he is PPA Health and Wellness. Reach out to him. Reach out to his partner over there. What's her name again?
Dr. Naja Thomas.
Dr. Naja Thomas. So if you feel more comfortable with a female, she's his doctor. So hey, we're rocking with her too. So make sure to go to the doctor. Let's just start there. Get your butts to the doctor and check in and see how you're doing. Take care of yourselves, and we'll talk to you next month on the 13th with Dr. Middleton.
Good night.